Good morning, mamas. Welcome to Modern Day Midwife and Modern Day Mamas, which is a time for women who have questions about their pregnancies or their gynecological issues. And it's just time for your midwives to give some advice based on our years of experience. We want to start off by saying that we may not be your specific midwife, so any advice that we're giving, we highly recommend that you check with your specific provider on the safety and efficacy of what we're recommending. So today Carlene and I are going to talk about nausea in pregnancy.
Yeah, it's really common for a lot of moms to experience nausea in pregnancy. About 50 to 90% of women experience it. It usually starts about 6 weeks and peaks at about 12 weeks and usually resolves within the first trimester or at the end of, so around 14 weeks.
Mm-hmm. Yep, we usually tell our patients you'll start to feel better by about that second trimester or so. Mm-hmm. So it happens for a multitude of reasons. It's usually multifactorial and can affect every woman different. We have some women who have mild nausea and others that have pretty severe nausea, all the way up to something called hyperemesis gravidarum, which we really aren't going to get into today. We're just going to stick to just normal nausea and vomiting of pregnancy. The elevated HCG levels, which is the hormone that's helping the body to sustain the pregnancy, they're higher in the first trimester until that placenta grows and kind of takes over that process. But those elevated HCG levels, in addition to making your pregnancy test positive, can also make you feel kind of that nausea, which is pretty uncomfortable to people. Peristalsis or gastric motility is going to change in this first trimester as well. So you may have more times when it feels like it's coming back up, and that can be problematic for women. There's also changes because of the hormones and the acidity of your GI tract. Some of us aren't entering pregnancy as healthy as maybe we want to be. So some of us are like deficient in B6 to start with, or some of the B vitamins, and that can lead to kind of some discomfort as well. So
yeah. But what do we do about it? Mm-hmm. There are some things that you can do that are non-pharmacologic, which is some of my favorite things. So changing the time that you take your prenatal vitamin can be really helpful. Mm-hmm. So taking it at nighttime with meals rather than in the morning can be helpful, and always taking it with a meal. Also, maybe changing to a gummy vitamin can also be helpful. Making sure you're not taking a vitamin with iron. Sometimes iron can upset our stomach more unless you're told that you are anemic and that you need to do so. Really cutting that out can be helpful in your nausea.
We have some good ways too, if you're our patient specifically, to help you to metabolize iron that isn't from a synthetic form anyway. So you can talk to us about desiccated beef liver or which foods specifically can help to increase your iron. Sources of heme iron are always going to be more bioavailable in the body than the synthetic stuff you get from your prenatals anyway.
Yeah. You also can replace your electrolytes, which can be helpful. So, if you're vomiting or you're not really getting too much, replacing that can be a good way to make yourself feel a little bit better. So I really like coconut water, but I know it's a really specified taste if you like it or not. You can also use electrolyte packets. Mm-hmm. So there's multiple ones out there that are a little bit healthier than things like Gatorade or Powerade.
Yeah, just kind of look at the ingredients of the things. We really just want a replacement of your electrolytes instead of an adding of a whole lot of chemicals or artificial anything, colors, sweeteners, all that kind of stuff. Mm-hmm. And then vitamin B6 is something that's pregnancy category A, and so you're pretty much going to find across the board most people are comfortable with patients using vitamin B6. We usually recommend personally to our patients 2 to 3 times a day. And some of our patients end up adding half a tablet of doxylamine or Unisom at night, but please check with your specific provider to see if that's okay with them. But we found that to be really, really helpful and sometimes all that is needed. The other thing to understand is we're not probably going to be able to get you, nor is it realistic to think you won't have any nausea when you're pregnant. You're pregnant. And so part of this is going to be an experience that you're going to have to ride. Think of it like a wave. You're just going to kind of get through some of these feelings. When you get to the point where it is interrupting your activities of daily living so significantly that you need intervention, then that's when intervention is needed. But otherwise, just know that some of this is just a part of being pregnant.
Mm-hmm, mm-hmm. the goal of therapy is not to take away your nausea completely or to take away vomiting completely. And some days are worse than others, but trying to do everything that you can be helpful. Also, small frequent meals through the day, I think, is one thing I usually tell a lot of moms about. So really trying, if your stomach's too full, you can feel nauseated, or if it's too empty, you can feel nauseated. Mm-hmm. So sometimes doing something straight away in the morning, right when you wake up, can be helpful. And just every 2 to 3 hours, make sure that you're kind of sticking some little snacks and bites in your mouth.
And most women, if they're working women, have a long time between what they're considering their lunch break and then their dinner break. And so I think that 4 p.m. time is another time when people just feel kind of nasty. So having something that you can have as a snack quite quickly, but that isn't necessarily a processed carbohydrate, so a handful of nuts or a Chomp's beef jerky stick if you can tolerate that, but something that you can get high protein in is going to be helpful in that afternoon to kind of sustain you until you're getting to your nighttime. I like ginger if you enjoy that taste. Some people also don't care for it, but you can get ginger lozenges or ginger chews, and there are some ginger gum. I know Altoids used to make ginger. I'm not sure if they still do, but all of those things are helpful. And then me personally, I liked lemon, so I would use an essential oil of lemon, and I know Tracy is another one of our midwives liked peppermint. And you can keep that either on a hanky or a rag, and you can keep it in your pocket, and when that happens, you can smell it, and sometimes that's really helpful as well.
Yeah, there are some things out there at Target that I'm sure you've seen also, some over-the-counter things that can be safe. Just look at the ingredients on them. It's usually vitamin B6 and ginger, like Mommy Pops and stuff like that. So just kind of looking and making sure, and be careful of added sugar and dyes and stuff like that too.
Yeah, and if you do have severe dehydration, and you can tell that, usually just look at the color of your pee. The closer the color of your pee is to water, the more hydrated you are. The closer it is, if it starts looking like apple juice or iced tea, we've got some issues. Try to drink fluids when that happens. And then if you don't see improvement in that, you need to see your provider and see if you have dehydration and if IVs at that point are needed. So hopefully this was helpful for you guys. Feel free to give us some feedback, and more to come. Do you have anything else to add?
I don't think so. Yeah, have a good day.
Bye.